Hello and welcome to the Pet Healer Podcast. This is your host, Dr. Mitzi Vargas, and today we're going to continue talking about kitty cats, but this time about anorexia. Anorexia basically is lack of appetite, and there's multiple causes for it to happen. One of them is pain, and the previous episode we talked about pain. And it could be oral pain, bad teeth, stomatitis, inflammation of the oral tissues, growth, tumors inside of the mouth, and such things. But those can be quickly determined, sometimes by the owner and sometimes in a quick examination. But oftentimes, chemotherapy could be a side effect of changing the diet or doing new medications that like chemotherapy or any kind of medications that the pet is in. And the problem with anorexia, especially when it's kind of like chronic, they're picky eaters and they just not eating, is that is one of those measures of quality of life. If you don't want to eat, you're kind of trumping your survival instinct, especially cats. When they're done living, they will just commit suicide. They would just not eat anymore. They would try to escape the house and keep walking until they can't walk anymore. So we want to make sure that we treat the inappetence, the anorexia in a different way, that we jump on it. In cats, obviously we, as an integrative practitioner, we here treat them a little bit different. We use acupuncture. And one of the sets of acupuncture that I use a lot is Shangen. Shangen is in the dorsal border, hair, non-hair border of the nose in dogs and cats, in any animal really that is a mammal. But I use it in cats, and it actually works tremendously, very quickly. I also like to do stomach 36, 37, 39, which is the stomach's points, and it's on the back leg. And it actually, that helps them, kind of like receive the food. And it really, I see a big appetite increase. I think that when there's cachexia, which is weight loss due to a cancer process, then it's often accompanied by inappetence. And so we need to make sure that we diagnose, we look deep and do blood work or x-rays to try to find the cause. If there is a mass, if there is any process that we can somehow treat, then that's wonderful. Then I think the inappetence would be the secondary symptom. So once you go to the root of the problem, you often resolve it. In Chinese medicine, veterinary traditional medicine, we actually think of inappetence as a spleen qi deficiency, or, it could be spleen heat. Spleen is the meridian that is controlling the appetite. And in that case, we always say that the spleen gives you the Gucci, because the Gucci is the energy of the food, and the energy of the food is transformed in the spleen meridian. And of course, the spleen meridian, if it's not working, it's there's too much heat, or is there no energy in it, then it's going to affect the appetite of the pets. And so there are multiple herbals that we can use to increase the appetite. 8 gentlemen, 6 gentlemen. Those are herbals that are very old, and formulas that were thousands of years, and they work very well to kind of like restore the appetite. But there are some drugs that we use too. So mirtazapine, which, it comes in a gel too that you could use in the ears on the cats. I use that a lot, mirtazapine gel, and I have good results with it. And ties, I use it a lot in dogs, but you can use it in cats as well. And those are capromorelin, and this is a molecule that actually stimulates that appetite in the brain. So it really helps. It really helps most dogs start eating within a day or two, and that's why in the label it often says 3 days, because after 3 days, usually 90% of them are eating, the same with the dogs and the cats. So the entice is the name of the drugs, and Elura is the name in the cats. Same for the same molecule but in different names. But there's a very wide margin of safety for cats, and so I wanted people to know that you could use Elura for especially the cats that have kidney disease, because inappetence is a very, very common symptom of kidney disease. They go hand in hand or together. And so some other diseases that I see is pancreatitis. Oftentimes, that's the only sign I have that the cat has pancreatitis, is they won't eat. So once you put the test, the feline pancreatitis test, and is positive, then I can start using appetite stimulants in addition to whatever supportive treatment I'm doing. So another one of the things that is cyproheptadine, I used to use it in cats, but I didn't have that great of a response as I have with mirtazapine. Now, steroids. I know that a lot of people like steroids for appetite in cats. And if the cat has lymphoma or IBD, I think that's a good idea. I don't use it at the dosages like 1 meg per kilo or anything like that. I don't use it at high dose, but I do it as just like getting the inflammation down enough so that they actually want to eat. And so if they have cancer, if they have chronic kidney failure, if they have some terminal disease, then we're not so focused on the side effects of the drugs, right? We just want quality of life for as long as we can have it. And so that's when I consider steroids. But we know that it has so many side effects. Another thing that I would consider would be Serenia, because it's an anti-emetic, anti-vomiting medication, also anti-nausea in the cats, and therefore it's an indirect appetite stimulant, because if the cat doesn't have that sour stomach, if they don't have that nausea, then they'll be more willing to try the foods. And so I feel like acupuncture is a great tool, especially aqua using B12. And I feel like we have herbals available as well. They can work together with the capromelin and the mirtazapine or the steroids if it's needed to restore the appetite. Appetite is life. That's why we get so concerned. It's a quality of life measurement, and we need to really pay attention to it. And so I hope that you learned something today. I hope you share this episode with your friends and help us support the Pet Healer podcast going forward. Thank you so much for your time, and see you in the next episode.